Hello everybody, welcome to SHEENA'S Guides. Thanks for all the feedback you have given me. So today I have got something for the non-medical prescribing. I have done my non-medical prescribing 2 years ago. So quite a few people have been asking about what questions comes from the BNF or from the pharmacology or from the like can you provide some sample questions for the maths exam. So I thought, why don't I make a video about it. So today my video is the sample questions which generally comes around from the BNF. It's not from any particular universities. So this is just what I thought could be coming out from the which I went when I studied my prescribing. This is what I did it, and that's what I'm just forwarding it. So I picked up around 15 questions as a sample questions from BNF, which I'll go through now. So today for my sample questions for the non-medical prescribing pharmacology, the BNF what I have taken is the BNF 78, which is from September 2019 to March 2020. So if you have a bit more advanced like the 2021 BNF, the pages may be different, so just look into it. So as I said, BNF is when you're doing the prescribing module, BNF is your Bible, so get to know your pages. That's the main questions, the main motto for it. And when the majority of the questions what they ask for the prescribing exams, the answers will be in the BNF, so that's why get to know your BNF. The question is, what are the factors contributing to poor compliance with the prescribed medicines? The answer is on the guidance on prescribing. That's on the page 1 in the guidance of prescribing. And if you go down, that is taking medicines to best effect. And the answers are the 9 bullet points. So you need to write all the 9 points, because sometimes it may say that it is 2-mark question or a 3-mark question. So it's always best to write the 9 bullet, unless it is specified and say that you need to only write 4, then you only write 4. If it is not specified, then you need to write all the 9 bullet points. Second question is, what do you mean by deprescribing? Again, the answer is in the BNF, and it is on the guidance on prescribing. It's on page 1, and if you go down, there is a paragraph about deprescribing. So if you write the answer based in that paragraph, and and you just have to write what do you mean, the definition of deprescribing from that. If you know yourself, yes, well and good. Otherwise, just write what is being given in the BNF. That will give you the full points. The next question is, what are the national targeted groups for medicine use review? So there have been some targeted groups where it is more important that these people need a regular review. And so what is the guidance regarding? The answer is in the BNF, and if you go on to page 1, and it is at the bottom, they says medicine use review, and that 4 points are the answers to it. And if you write all the 4 points, that will give you the full marks. So it is a nutshell to say that get to know what is being written in the BNF. That will give you a full marks, or that will score points for your exam. Next question is, what do you mean by biological medicine? Again, if you go on to the BNF in the guidance on prescribing on page 2, and there is a paragraph about biological medicine, and the definition is in that, and if you write it from there, again, that will score you for that. The question number 5, how to keep the medicine safe at home? I think this question was asked a couple of times for all my friends in their prescribing exam. So this again, the answer is in BNF. It's on page 4, and if it it says guidance on prescribing and safety in the home. And if you write all the bullet points, answers are the bullet point in bullet points. And if you write all the four of the bullet points, you will score marks for it. Question number 6. What all the information needs to be included while labeling the prescribed medicine? Again, it's in the guidance on prescribing in BNF in page 4, and again it says what all needs to be written when you label the when you put a label on the medication. So it says that about the name of the patient, name and address of the supplying pharmacy, date of dispensing, name of the medicine, direction of the use of the medication, and any precautions relating to the use of medicine. So if you write, and it's all been written in bullet points, and if you write all that, you will score marks for it. Question number 7. How can we improve the security and validity of the prescription? It's on again in the BNF on page 4, and it says the security and validity of the prescription. There is a bullet point for it, and if you just write, and there is 3 bullet points, and if you write that in your answer, that will again give you a full marks to it. Question number 8, about the prescription writing. It's a very must question. Normally it carries around about 10 to 15 marks. It's sometimes you may be told to write a prescription on a certain drug, but majority of time it would be a scenario, like for example a 55-year-old gentleman with a chest infection has got an EGFR of 30. The NICE guidelines, based on the NICE guidelines, the patient can be given says the first line of treatment is amoxicillin. So you can prescribe the amoxicillin, but look at the EGFR. So read the question thoroughly before you start prescribing it. And when you prescribe it, the strength and the quantity has to be contained, and whether it is a tablet form or a capsule form, it has to be written. The milligram has to be written, so everything in detail. And the requirements of in the prescription writing is written very clearly in the prescription writing in page 5. So based on that, write everything very clearly. Write the name and address of the patient, the date of birth or the age, and your signature and your name and address. Go through it very clear, again and again, because that carries around about 10 to 15 marks. So that's quite important. The next question is, how many types of schedules are there in the control drug, and what are there? Normally there is a question about control drug, and that is also being found on the BNF in page 8. It's about in the control drug section and drug dependence, and there is and it is clearly mentioned about the different schedules, types of schedules, schedule 1, schedule 2, schedule 3, schedule 4 and 5. So that can be written. So there is a section about control drugs and the drug dependence in page 8. The next sample question is, how can you prevent an adverse reaction? It's on page 13. There is a section called adverse reaction to drugs, and there is a column how to prevent prevention of adverse reaction. There are a couple of bullet points. Again, sometimes they will tell you to write 3 or 4 bullet points. Sometimes they tell you to write, they won't specify it, and you may, at that point, you may have to write all the points what is being given in the BNF. My next question is, why the identification reporting of adverse reaction to drugs in children and neonate is important. It's on page 18 in BNF 78, and it says about prescribing in children and adverse drug reactions in children. So there is a couple of bullet points there, and you can write from there. There is always a question about prescribing in children, so get to know the pages of BNF is very, very important. My next question is, what are the issues encountered when prescribing for reduced renal function? It's on BNF on page 19. It's prescribing in renal impairment. So it's there would be questions about prescribing for renal impaired patient or elderly patients. So there are there is so always when these questions are asked, always look on the BNF. There would be some answers and you can write it from there. Next question is a scenario question which comes from the BNF also. For example, I have put a scenario of what a patient X who is an African who is already on a calcium channel blocker, but he's not tolerating it. So what would be your next drug of choice, and can you do how much milligram would you start with? So there is a page about hypertension. So if you look at the back for hypertension management, it will tell you which page it is. On BNF 78 is on page 140, starts from page 140, and page 141 it says what are the drug of choice for patients over 55, and if it's a kind of African or Caribbean family origin. And it also says if the calcium channel blocker is not tolerated, what should be the other drug of choice. So, and then based on that you can go on to the page where the medication, the drug is, and you can prescribe the medication. If further it says about the kidney functions, or it says that this patient is on so and so drug, then you may have to look into the interaction page to see if there is any interaction to this drug. And my next scenario question is about a patient A who has got Helicobacter pylori positive, that is H. pylori positive, and we've been asked to do a prescription. We've been asked to tell what medications would you prescribe for this patient. So you have to write what medication and the strength of the medication you would prescribe. So on page so on the back of the page, you can, on the index, you can look for whether H. pylori treatment or Helicobacter pylori treatment. And on the BNF 78, it's on the page 73. There is a table for it and what you have to prescribe. So based on that, you write what antibiotics you would prescribe and what milligram and how many days would you prescribe, and and the lansoprazole or the omeprazole, what you prescribe and how much would be the milligram, and how many days would it prescribe. There would be some scenario questions like, for example, an elderly lady having a urinary tract infection and EGFR is so and so, and what would you prescribe for this lady. So you need to look into the BNF for that. For example, a lady with a gentleman who is on sertraline 50 milligram or 100 milligram and is not tolerating the sertraline and would like to get up his medication or change his medication, what would you prescribe? So this is all there in the BNF. It's just to look into the BNF and see what is the management and how do you up the dose or reduce the dose or change the medication. So these are the scenario questions which I thought would be based on, so this gives you an idea how the scenario questions are made of. So the final few more questions. So there would be also some questions regarding yellow card. How do you report if you have an adverse reactions or allergy reactions? How do you report and how do you fill the form of the yellow card? So about that, there would be a question, if there is a question, it is also in the BNF, and there will be some abbreviations given, so POM, prescription only medicine, or so that is at the back of the BNF, and the abbreviations are all there, and you can look into that, and you can write what the abbreviation says meant. So it probably given POM, and so you have to look into and what is it, and you can write based on that. And also there is always a question about cautionary or advisory label. For example, if you have been told that clarithromycin is prescribed and you have been told to put a label, what label would you put? So you have to write the number as well as what the number says also. Or for example, the question would be like, for example, the so-and-so medication is prescribed for a patient, and the advisory label says number 7 is the advisory label. What does that number 7 meant? So you have to look at the advisory label and see what that number 7 says, which says that do not take milk or any indigestion remedies along with. So question can be in a different format. And always there would be a question about interaction, and it would be also made in a scenario form. For example, you have prescribed so-and-so medication and the patient is already on this medication. Is there going to be any interaction? If so, what interaction would it be there? And if you go on to the interaction page on the appendix 1 and on BNF 78, it's on page 1373. And if you have been asked about questions like pharmacodynamic interactions or pharmacokinetic interactions, there is already paragraph there, so you can look onto it and you can write the answers based on that. So on that is on the interaction, and there is tables of how each drug affects and what is the drug interactions and everything. So there is always a question about interactions, advisory labels and everything. So what my advice to everybody is that when you get a question paper, always read through the questions, thoroughly read through the questions. Most of the questions will be in the answers will be in the BNF. So going through and looking through the BNF is quite familiarizing with the BNF is quite important. There would be only a few handful of questions which you have to we have to remember and write it. Thank you very much. Thank you very much for going through my video. Thanks for watching my YouTube channel. Hope you liked it. If you have any questions, anything regarding the non-medical prescribing sample questions which I have provided, please put in your comment or send me an email. My next video is about the pharmacology sample questions, and after that would be about the max sample questions. Thank you. Thank you very much. Please do, if you have not subscribed my channel, please do click on the subscribe button and like and share. Thank you.